Okay, welcome everybody. Thanks for joining us today for the HRI seminar series. See if we can get through it without any tech. So I just want to begin by acknowledging we're gathered here on the traditional unceded territory of the Clay and just on this beautiful spring day with the sunshine, first day of spring, just really take a minute to reflect on these beautiful lands we live in and what that means, for all our opportunities that we have in our lives. And there will also be people joining us online, so I welcome them to share where they are joining us from. So this is our HRI Seminar Series Planning Committee. Myself, Kendra Ferber, Rayanna Robinson, of course, Leanna and Bree, who keep us all organized, and our student representative, Lucia. And also, thank you to our financial contributors, which is Sun Life and the Faculty of Human and Health Sciences here at UNBC. Just a reminder to check out the new HRI Connect portal. This will put you in touch to all other health researchers at UNBC, but also in the Northern region. And our upcoming events. But that's okay. This is our March seminar series. And so just for a note for April, we will be having the honors students, the health science honors students presenting their thesis research. So please keep your eye out for those emails and join us for that. It's always really fun to see what the students have been up to.
This is our slide from last month. This slide didn't upload.
Oh, there it is. And then an upcoming research and quality conference as well. So save the date for that.
Let's see.
That's okay. I'll just do that. So today we are delighted to do a panel discussion about different careers in health research. And I know I have trainees been asking about this, and we've been really excited to do one with having just a diverse group working in different fields. So our panelist today is Andrew Giles, who is a senior lab instructor in the Division of Medical Sciences. Cecilia Ballamore, who's a clinical research coordinator for Northern Health. Jana Olenek, who is a data analyst for Carriers County Family Services. Vanessa Mitchell is a research associate. She's online here with the National Collaborating Center for Indigenous Health. And we also have Carleen Panda here, who is a PhD student down at UC Berkeley now. But I just wanted to mention that all of these panelists are UNBC research alumni in some way. And we are so happy that they're still here doing research. And I just want to give them the opportunity to tell you more about their journey and their position now. So I'll send it to Andrew.
Hello, everyone. As Kendra said, my name is Andrew Giles. I'm currently a senior instructor in the Northern Medical Program. So it involves a lot of teaching and interacting with the medical students, as well as a little bit of research in collaboration with Dr. Ferber and Dr. Gray as well. My journey started as an undergrad at Queen's University in Ontario, Kingston, Ontario, where I studied life sciences, which is sort of like a degree that's like a survey of many different aspects of human biology, with many people taking paths into research, medicine, other aspects of healthcare, X-ray technology, all these different things. So it's a really good sort of introduction to health sciences. Gave me a very good background. And one of the things that I was most interested in was neuroscience, or the study of nervous systems. And so I did grad school, applied for grad school and went to grad school at UBC, where I got my PhD in neuroscience. While I was there, I studied a small model organism called C. elegans, which is an excellent genetic model for studying the nervous system. After my PhD, I did a 1-year visiting fellowship in Japan at the University of Nagoya, which was a really excellent experience. I definitely encourage people to take experiences like that, where you go to a different country and experience work and life in a different country. After that year, I got a position as a postdoctoral research associate at the Scripps Research Institute in Florida, which was, a great experience. It was sort of improving my, sort of expanding on the research that I'd done in my PhD, but more, I guess, looking at, my PhD was more at the, looking at just how the nervous system works, whereas my postdoc was more looking at genes that are involved in health disorders. So one of the ones that I focused on was a gene that's involved in developmental delay and mental disability. And basically, we knew almost nothing about how it was functioning in the brain, and so we were trying to really get an understanding of its function in the brain, so we could understand how it's working and why, when it breaks, it leads to brain dysfunction. Finally, I moved back to Canada. My family was really excited to move back to Canada, so we did, and we love northern British Columbia. So we moved to, we looked at various places and chose Prince George. And I reached out to actually Kendra initially and found a research position in her lab as a research associate, which gave me an opportunity to learn, sort of go back to applying my knowledge to the mammalian system, which is a bit more closer to human biology, and therefore you can make some different inferences. And this allowed me to sort of meet more people here. I started working with Sarah Gray, finding opportunities, which eventually led to the position as a senior instructor, which I'm currently enjoying. I've been in that position for about 6 months, and that's sort of a summary of my career so far.
Hey, hello and howdy, everybody. My name is Jana Olenek, and I am currently a data analyst, and as of Monday, analytics and reporting supervisor at Carrier Sakani Family Services. So in other words, I'm a big data nerd, but my education started back in 2010 at UNBC when I started my undergrad bachelor's of science in psychology, working closely also with the health sciences program. And I had different research assistant jobs throughout those years. In 2014, when I graduated with my BSc, I continued on to get my Master's of Science in Psychology as well, thesis-based research. And at that point, I was working actually for the Health Research Institute with both Leanna and Bree in following years. And I've held various jobs over those years from 2014 until present on different kinds of studies across primarily health, psychology, nursing fields, also peppering in a little bit of, say, economics research and other fields, because I do think it's important to focus on interdisciplinary collaboration where possible. One of the first national projects that really got me into research was on the nature of nursing practice in rural and remote Canada, looking at scope of practice, recruitment and retention, and other factors across the country for RNs, LPNs, RPNs, and NPs. Over the years, I've partaken in different projects ranging from the use of technology in later life to working in the embodied cognition lab here at UNBC. I don't know if anybody's familiar with Dr. Siakla. He told me years ago that stacks were cool, and I thought, yeah, right. And now here I am. Back in 2019, I shifted positions and went to work for Northern Health as a clinical outcomes analyst, meaning I handled all analytics and reporting specifically for regional chronic disease, emergency transfer, and trauma and patient transfer. I think I said that one. So that was a really great position, working in different electronic medical record databases, doing reporting, but also getting to be involved in research projects as they came through Northern Health as well, still maintaining that partnership with UNBC and the HRI where possible. I have been in my current position with Carrier Sekani since July of 2021. And even though my roles and responsibilities now aren't specifically on research projects, I do think that a lot of the skills from my formal education, training, and work experience have prepared me to work in my role. For instance, I still sit on ethics review boards for joint research projects with CSFS, UNBC, UBC, Northern Health. I oversee some data governance, database administration, and am also involved in reporting and data preparation and analytics for research projects that come through Carrier Sekani. So for instance, if there's a wildfire research study, I will then be pulled into the analytics for that, making sure that things are done with rigor, the data is clean, accurate, and all the other associated tasks. So that's my story, and I'm sure I'll fill in bits and pieces as we go.
Hello, my name is Celia Bellamore, and I'm a clinical research nurse coordinator. And that is not a path I ever thought I would take. So my path was largely healthcare for many years. I started off as a care aide and an LPN, and when I was in school and I took a research class, I was incredibly intimidated by the language of research and the language of the math and the statistics that came with the research. And frankly, I failed my research class and had to take it again and again. And I got kicked out of the program because I didn't do it. And I fully failed out of the nursing program. And that's how I got to be an LPN, because at the time I could challenge and go be an LPN. So I have a letter, I'm going to frame it and put it on my wall, saying you are never allowed back in this nursing program again, because that was the rules at the time. And so I went off and went to go be an LPN, and I've worked all over the North, and I took jobs, travel nursing, and you name it. I took jobs, mostly acute care in hospitals, but some community care as well, working with all kinds of age groups, everything from babies on ventilators to adults in their last days. So I just had a spirit of adventure, grabbed my guitar and my car and worked healthcare, and not a second thought to that awful research class that thwarted me from my dreams of the RN. But then I ended up in Vancouver to support my spouse in their dreams of their education. And this job posting came up, looking for an LPN in research. And I thought, okay, I'll take a look at that. Because after working for a long time, I realized I had this passion for understanding and wanting to know more. Why are people so sick and they keep ending up in the hospital? And what can we do more to keep them out of that? And I realized that research was more about the stories and the people behind it and all the factors that went into it. And all the fancy bits of language were just ways to standardize those stories. And that's what I didn't get when I first started it. And all that math was to describe those stories in the big fancy journals. I was learning, I was maturing. So I applied for that job down in Vancouver, and gosh darn it, they hired me with no experience at all. I couldn't believe it. They took me on, and it was nothing like the movies. There wasn't big fancy labs with huge amounts of funding and stuff. It was a chuck you in a lab coat in a broken down building that we might have been kicked out of at any time, with this wild haired coordinator and researcher from the Deadhead days, and she was a fabulous mentor, teaching me the real science and research of things. And she was a fabulous mentor. And she kept saying to me, listen, you got the head and the heart for this. You need to go back and get your RN. You need to go back to school. You need to actually do this. So she taught me the ropes. She got me all the way up to being a coordinator before she retired. And by the end of it, we were doing surveillance, 900 beds. We were the Vancouver site. Pandemic preparedness, don't get me started on that. But pandemic preparedness for respiratory surveillance and doing vaccine trials. So the last stop before you get an experimental vaccine into your arm is me and doing those checks. And if you said yes, I put it in your arm and did all the documentation. So, but public health being what it is for funding, we had to shut our site down December 31st of 2016. And I took that shutdown as an opportunity to go back to school. So then I decided, yeah, okay, what am I going to do? Am I going to go? I was going to think of doing a policy and thing at Royal Roads, or maybe I'd go back for the RN. And I looked, and the rules changed at UNBC. So I decided to take a roll the dice and say, hey, is forever actually forever? Or will you take me back? And it was a lot of conversations and a lot of it wasn't an easy road, but the nursing program at UNBC let me back in. Not only did they let me back in, they let me back in on a fast track. And I'm actually a fairly recent grad. I graduated in 2022. Hey, and used that job, and I got a clinical research program, coordinator program here. Now that job didn't exist when I graduated. There was a little casual posting for a brand new research institute called the Northern Center for Clinical Research. That was just a little baby institute getting started up. And I said, listen, I'm graduating, I'm looking for work. These COVID jobs are drying up, and I'm looking for work. Let's see what can happen. And so now we're starting a new institute and a whole new program, because I had to go to Vancouver to learn how to do clinical trials work. And what we're hoping to do here is to build, so HRI is doing this huge health research part of it, but that last little piece of that clinical trials work, or that last little bit of the drug that goes into people's bodies, no one here was doing it. So I'm hoping that as we build this program, people like me can train students like you to come learn here, so you don't have to go to other places. And you can come work with us, and we can figure this out together. So that's, I mean, a very, very short snapshot of a very long and winding career.
And so now, thank you guys. If you want to go online, Vanessa, did you want to speak to your kind of background and experience?
Sure, can you hear me okay?
Yep.
Awesome. Well, Haskell Hall is quiz Tamilta, isn't sama is quiz Vanessa Mitchell, Gentil and Kamapalax, or Kalchinhulau Kikanmut. My name is Vanessa Mitchell. I'm from the Okanagan Nation, and I'm in my home community of head of the Okanagan Lake, outside of Vernon, BC, and more specifically, I reside within Round Lake, if you're familiar with the geography of the interior. That's what I was sharing there. One of the things for myself, you know, of course, I'm a mother, daughter, sister, aunt, niece, and a little bit of my journey is actually unpacking those parts. So my bachelor's degree was very much focused on Indigenous studies, and I saw it as very much a healing journey in the sense of understanding how colonization has impacted every facet of my life and finding language for that, because throughout my life I had felt it by either words said to me or just door closed after door closed. But by engaging in education for myself and unpacking what colonization is, and even understanding that as a concept was really healing. So I threw a lot of books across the room, just being frustrated and angry. And then as a summer student, I had worked for the Okanagan Nation Alliance in all of their different departments. And at the end there of 13 years or so of working within my own nation organization, I was brought into the realm of health more specifically because I'd always been working with youth and elders. But in this time, it was during the transition of Health Canada to First Nations Health Authority. And at the time, I was considered a hub coordinator. So rather than talk to 200 First Nations in BC, how they were communicating is they were connecting with nations and then having them distributed out. So that's when I really got immersed into health specifically, and where I also was introduced to the concept of cultural safety. And that led me to my master's, which was a focus on cultural safety, and it was a Master's of Arts in Interdisciplinary Studies. And my understanding of cultural safety is that it came from the lands in New Zealand with the Maori people. And so I really wanted to have a look at, is that even a term for us here in the Okanagan? What do we think about when we think about being safe within accessing healthcare? And so having those conversations in community. And I remember I was in my second year, probably the first and second years of my master's, and this term cultural safety. And I remember being asked, "Oh, so what do you do?" "Oh, I'm doing research in cultural safety." "Cultural safety. Can you get a job with that?" And I remember at the time, this was way back in 2015. I remember at the time going, "Oh, God willing, I hope so." I'm just going where where my passion is leading me. There was no positions that were entitled that up until that time, at least to my awareness. And in 2015, lo and behold, there was a position within Interior Health, Aboriginal Cultural Safety Educator. I threw my name in the hat there, and that led me to work in Interior Health, specifically around cultural safety, curriculum development and delivery. And I was able to bring physician advisory because we needed accreditation, and also a community advisory from the 7 nations, including Métis, to come together because it's really around cultural safety, education and training for the staff, and being really the best that I could be transparent with what that was going to look like. Because cultural safety, not everybody understands that it's not actually about teaching culture. And so really being clear with that. And then in my work with Interior Health as well, I was what they called an Aboriginal lead at the time. So I was a part of a lot of regional conversations and regional work around health, specifically around letters of understanding. So each of the nations want to make sure that they're having conversations and being in partnership and holding the health authority accountable to that partnership for the health of their people within these facilities accessing healthcare. And also a community, yeah, and also just the different initiatives that can happen within health. And with because there are 7 nations and the Métis, um, each lead was designated to specific nations just to, spread out the work and that one person wasn't doing them all or connecting and working with them all. Um, and I ended my time at Interior Health in 2021. And then I experienced my own health. Um, I am a breast cancer survivor, and I went through that journey of really being reminded that while I can be a strong advocate when I'm standing on my own 2 feet, um, there is an intense vulnerability going through these, and anybody going through anything within healthcare, you know how vulnerable that is. And for me, it was really interesting to reflect upon that and what happens when you're told to advocate for yourself, but you're in your most vulnerable moments and navigating, life changing health outcomes. And that once I was going through that process, I did manage to get my PhD application in to UNBC. And it's in health sciences. And again, my focus is on cultural safety. And one of the things that I think about is a tenet of cultural safety within healthcare specifically is that Indigenous people see themselves reflected within the system. And if they're to see themselves reflected in the system, that means they need to see Indigenous employees within these systems at all levels, including, but not limited to, direct point of care, but also in leadership and every other aspect of health and the health system. And so if that's a tenet of cultural safety for us as Indigenous peoples, as patients, then there needs to be focus more on just recruitment of Indigenous employees. There needs to be focus on retention and advancement of those same employees. And having worked inside a health authority, I could see that that is lacking. And so that's where much of my focus is right now. And I think I'll just close with they were asking me what title to use for this presentation. And one of the small things that I do, like out of the many things that I do, not small, but one of the things that I do is I do work for NCCH as a research associate. But I'm also a school board trustee and a UBCO sessional instructor. I've taught social work and Indigenous peoples to a master's class, and for the undergraduate Indigenous studies research applications. And that's where I discovered and was able to articulate that I really am a research geek because I love reading the students' projects and can see the possible pathways. Whereas maybe even a couple of years ago, I wouldn't have identified as that. And then I'm also a consultant. So because of my long history, of which we're all just giving a snapshot, I've been able to work with College of Physicians and Surgeons, College of Optometry, College of Traditional Chinese Medicine and Acupuncture, and massage therapy, as well as provincial language services around Indigenous languages within healthcare systems, and at a community level around public safety and health planning and community comprehensive planning. So I have a wide gamut of things that I'm working on because I like to. So I'm going to close there because I think we only had so many minutes. So I'm looking forward to the listening to everybody. Thank you.
Thank you, Vanessa. Carlene?
Everyone hear me okay?
Yeah.
Okay. Okay. Hi, everyone. My name is Parlene. I'm tuning in from San Francisco, which is on the ancestral lands of the Ramaytush Ohlone people. I am currently a PhD student in the metabolic biology program, which is at the University of California in Berkeley. But my research lab is at UCSF within the Diabetes Center. Thank you so much for having me here today. It's truly an honor being a UNBC alumni and now getting to share how research at UNBC has really helped me in my very early research career right now. So I was born and raised in Terrace, British Columbia, and Terrace is still home for me. My parents still live there. That's where I go when I go home for Christmas. So I'm very much still a Northern BC girl. I graduated high school in Terrace and then came to UNBC for my undergraduate degree, which was in biochemistry and molecular biology. During my undergraduate degree, I met Dr. Sarah Gray when she did a guest lecture for one of my classes. And during that time, I then reached out to her. And after a few meetings, I had an opportunity to be a part of her research group and conduct my undergraduate honors thesis in her lab. After I finished my bachelor's in 2019, I applied for a master's degree at UNBC in biochemistry, where I was able to continue some of the work that I started in Dr. Gray's lab. So the Gray Lab focuses on studying some of the biological mechanisms of metabolism, specifically focusing in on obesity and type 2 diabetes. And my project in the lab focused on the body's response to cold stress and activation of the nervous system to try to rebalance and maintain homeostasis in the body. When I finished my master's degree, I was very done with school at that time. My degree sort of overlapped with COVID, so it was challenging in that. I had to reduce a lot of my wet lab experience, and I wasn't able to go to many meetings and share my research. But after finishing my degree in 2022, I accepted a position to be a lab/research manager within Dr. Gray's lab. And while I was there, I supported and trained other lab members and still conducted some of my own experiments, carrying on with some of my master's work. During that time too, I actually had the pleasure of meeting and working with Andrew, who is a brilliant scientist. So it's really nice to be on this panel here with him today. So like I mentioned, after my master's, I really wanted to take a break from school and only work for a little bit. But of course, after a few months, I wanted to go back to school and started applying to PhD programs. I was super motivated, and I was in a very fortunate position where I could move sort of to anywhere that I wanted to, considering that if I got accepted. So I applied sort of all over, and I was able to get an acceptance to the metabolic biology program at UC Berkeley. I'm currently in my second year of this program right now, and I'm conducting my thesis work in the lab of Dr. Christian Vase at the UCSF Diabetes Center. So our lab studies the brain's control of food intake, and we focus in on an organelle called the primary cilium, which exists in many cell types, including on neurons. So the primary cilium is sort of like an antenna-like structure that is able to integrate signals that are received outside of the cell and then communicate this information to the rest of the cell. So our lab is focused on studying how this structure is important and in sensing whole body energy stores and regulating appetite.
Thank you.
Thank
I'm
you.
gonna switch the order of the questions up a little bit on you guys because I don't want to run out of time. But I want you guys to be able to speak to kind of what really drew you to UNBC for your research training or education, and really what do you feel like the skills or the advantages of getting your education here has provided you in your future career path. So I might go back online first. Vanessa, would you, or Carlene, would you like to speak to this? Vanessa?
Sure. Sorry, there's two places I have to unmute, but yes, absolutely. So why did I choose UNBC for post-secondary training? One of the things that I was really mindful of having gone through an undergrad and a graduate degree is I want to be really selective of who I'm working with. And so I actually was really selective and intentional on who my supervisor was going to be. And I had been referred to Dr. Sarah DeLeo. However, I wanted to take it another step further and actually interview her because I knew I was going to be spending 4 years with whoever I chose as my supervisor. And I invited her to my home and we did an impromptu walk and a little bit of a ceremony, actually. I know we talk about it still today, and I think she might even be on the line. But for me, I was really thinking about who do I want to work with and who do I want wrapped around me. Having experienced again my bachelor's and my graduate experience for sure. That was one of the key things that brought me to UNBC was because that's also where she was. Even though I know she also teaches at UBC, UNBC fit better as far as the program around health sciences. Um, and as far as what aspects of my training have made me a better researcher overall, and I brought this forward with me even for my graduate, is I'm a firm believer in upholding community protocols and ethics because I do a lot of community-based research. And for me, honestly, community protocols and ethics supersedes and exceeds academic ethics. And on the one hand, that can seem interesting to say, but I also think that by following community protocols and ethics, they are actually higher than the requirements we need for academic ethics. So I'm not saying that I'm disregarding what we need to follow. I'm just saying a part of it is it's really important to uphold community protocols and ethics. And one of the things I'm really mindful of is right now I'm 49 years old and I've spent 49 years of building and cultivating relationships, and I'm not willing to risk that to meet a colonial deadline and colonial boundaries. So those are some of the components about what I mean about upholding community protocols and ethics. And I've seen that and the need and the practice of doing that from Indigenous scholars who have come before me. Also, listening and self-reflection. One of the things that I really think about is how much are we listening And also how much are we self-reflecting in the sense of if we're ever triggered by something or uncomfortable by something, how are we self-reflecting about that? Because that's our work to do. There's a distinction between doing the research alongside with and also maintaining self within that. Anything that happens for me is something I need to be accountable to and unpacking. And the last couple of things, know and articulate your why. Why are you doing the research? Why is it important with you? And working with people who are doing the work that align with your why. And always the willingness to make mistakes, but own mistakes. Thank you.
I can go next. Yeah. Why did I choose UNBC? Well, being from Northern BC, UNBC was, of course, very close to home. So it was a really easy choice to do my post-secondary education there. I'm sure my parents really enjoyed the fact that I stayed close to home as well. But it was also nice for me whenever I was feeling homesick, but even being at UNBC and staying in the north, it felt very comfortable. I felt like I was at home. Prince George has a very small town feel. UNBC itself also has a very like small town feel and it's very close-knit community. So that was really nice for me. And ultimately, part of the reason why I decided to stay there for my master's. I think that for at UNBC, the small class sizes really made my undergraduate degree very fulfilling in that I knew most of my classmates and I was able to really take the time to get to know my professors, get to know my GSIs, other people that were conducting research around me, and then also have them get to know me, tell them about myself, why I was doing research, and what my motivations were for my career and where I wanted to move forward. Um, so that was super important for me. And then there were also many ways to get involved in research at UNBC. So I hope that students that are here now know that it's really easy to get involved. You just have to reach out. I was super fortunate and was able to get involved early on in my undergraduate degree and then continue with that work. I I feel like researching at UNBC really made me a better researcher in that it helped me to learn to communicate my research to audiences with different research backgrounds, different science backgrounds. UNBC is super interdisciplinary, and there's always opportunities for people to come together to share their research with people that aren't in their same field. And I feel like that was really important in helping me improve my science communication while I was there. Thank you.
When we really did want you back at UNBC.
So happy to be back. So coming back to UNBC, I evaluated basically every major nursing school that was accredited in Western Canada. So mostly Alberta and BC. And because I was working for UBC at the time, I had a deal where I could keep my job, keep half my salary, and they paid my tuition. So I had a very sweet deal to stay in Vancouver, and it was going to take a lot for me to leave UBC. And I left for UNBC. And what was it that made me leave that sweet deal? Was by far and away, UNBC was willing to try differently, more than any other school. And what do I mean by that? Their program, so having worked in the acute care system and doing my research as a coordinator in the very large metropolitan hospitals means that I came in contact with the students who came through those systems, quietly observing them and having them come talk to me about their interests in research at that time. So every major school from the LPN programs and the RN programs. So I got to quietly see how they do their programs and talk to them as well. And I noticed that there's a high level of specialization and a very restricted level of skill sets that many things were put off till after graduation and on the job training. UNBC is not like that at all. It is very willing to work with the communities in need in the north to say, and with the employers to say, what is needed up here? What do you need our graduates to do? You need RN first call? Okay, we'll work that into your program. You can choose that as a path. You need, high level ER training, you need IV starts, you need, central line training. We'll do that right now in your program in the undergrad. It had the highest patient contact hours. When they said you're gonna go out and do your clinical contact hours, they meant on real life people go out into the field and with preceptorships and training. Whereas in the other programs, they meant you're mostly going to be working on plastic sim labs, and then maybe you'll get a little bit in the hospitals. We just don't have enough preceptorships down here. And I didn't realize that when I was first evaluating. I thought clinical contact hours were always people. Whereas UNBC, they said it's going to be intense. They warned you. You're not going to be able to work. It's going to be intense. Stop everything. You think you're going to have a relationship. Tell your loved ones you love them and you'll see them after the training. When it comes to the research side of it, it's integrated throughout. So yes, you have your research class, but they integrate throughout the entire program, how that lens is woven through, how to understand, how to work through it, how to read, how to embody research as part of that evidence-based practice. So even if you don't come join me, and I hope some of you will, or some of you online will come join me in building the body of evidence to inform your practice. Even if you don't, that you're practicing with that knowledge of where the body of evidence was created to inform your practice. And that understanding is right from day one. And I liked how UNBC put that together in their program as part of a collaboration. UNBC absolutely won my heart out for that. I mean, that's a very short way of putting that.
Okay. Okay. So I think I'll break this into two and say why I came to UNBC, and then looking back and reflecting why I'm so glad I did. As young 18-year-old Jana, I decided to come here because, like some of the other panelists, I'm from the North. And I think it is easy for the North to sometimes get overlooked, or patient voices to not be heard as loudly as urban centers. And growing up also in Terrace, to see where we could use, more evidence-based research, better knowledge, where we could benefit from greater support and people coming to the university and staying in the community or surrounding area. So I wanted to go to school and stay somewhere that would benefit my family, my friends, somewhere that I was passionate about, where I was part of the community, loved the community. But I also wanted to come to UNBC because, as I'm sure everyone's heard, smaller class sizes, lots of hands-on experience in labs, research settings, one-on-one with your professors. Let's be honest, cost of living when you're a student and have to take into effect housing, groceries, all of that. Prince George is more affordable. But now that I've reflected on it, one of the greatest things I walked away with is by working in these research labs and institutes, I got to be part of every single aspect of research projects. I wasn't just coming in to do data entry. Everything from project design to applying for ethics, whether just through UNBC or harmonized with other organizations, applying for funding. So your Michael Smith or CIHR grants I was a part of, collecting the data. My heart's in quantitative, but qualitatively, getting to meet the people and be person-centered and put people first is huge. That was a great advantage of being here. And then everything beyond that to data cleaning, coding, analysis, being part of report writing and that knowledge translation and dissemination piece to make sure that all the hard work and good work being done can be understood and accessed by diverse audiences and used to better practice or whatever the intent was. So that's something looking back, I think is so valuable, is really getting that full picture of what goes into research. And before wrapping this up, I'll just say, I think that's one of the main takeaways I would say is even if you really like research, but don't know if you want your career to be a researcher, there's always so many pieces that are helpful. Like right now, I'm not a researcher in my job, but what I've learned about, say, OCAP, so your ownership, control, access, possession of data, your data governance, how to write reports, give presentations, how to think about the ethics and, putting the people first that are part of the research projects. There's always so many ways that research experience can benefit you in any career path you choose, because so many things come down to planning, quality improvement. And so research really doesn't pigeonhole you at all. It just opens up so many other doors. Sorry, I digressed, but I'm done.
Good.
So I was at a sort of I guess a transition point in my career. I had, done all this sort of international research and then was really keen to move back to Canada. And applied broadly across the country and was not able to get a sort of research professorship position, which was very discouraging. And so we ended up my wife and I decided, well, we'll follow her career and move somewhere that we really enjoy. And then, I'll see sort of what I want to do next. And we picked Northern BC and moved to Prince George. And I was sort of in this sort of moment of, okay, well, what am I going to do? And first thing I did was look up to the university and see, who's there and what sort of research is there. And I was really excited to discover that there were people at UNBC that had overlapping interests with me. And not fully overlapping, but overlapping where we could work together. And I had skills that were in demand in the lab, but there was new stuff that I could learn as well to expand my own skills, and then hopefully look for more and more opportunities. And so that's sort of what brought me to UNBC was working with Kendra Ferber. But what sort of kept me at UNBC was then the interdisciplinary, collaborative, supportive nature of UNBC. Opportunities started to arise. Initially working in Dr. Sarah Gray's lab, an opportunity came up. And so I started this collaboration there. As well as the people working and the students at UNBC were excellent. For example, Parleen taught me in the Gray Lab all about qPCR, which was a skill I didn't know at the time. But she was really open to teaching me, but then also hearing the experience that I brought, and it was just an excellent work. Collaboration. Similarly, in Kendra's lab, working with Victor has been amazing. He's taught me so much, and I hope he's learned a little bit from me as well. And so this sort of like supportive, collaborative, interdisciplinary nature at UNBC is just really an amazing environment to work in. So that's definitely sort of what's kept me here, and just the opportunities that are here. And I really enjoy being in Northern BC, and it's been great.
Again, I think you guys have all kind of your passion for your research and really some of the, what you hold to your hearts and with your research, your priorities have kind of really come through in your stories that you've shared so far. I want to have time for the audience to ask some questions. So as kind of a final wrap up, if you have a few words, what would be the advice or the tips that you would give to the next generation, all of our young researchers in the room here? And I will just put this out generally to the panel. If anybody would like to speak to it, please just jump in.
One piece I can start. One piece of advice that I have, and this is just from personal experience, is that a lot of the time in research or anything that you do, the effort you put into something to prepare an application or collect data, it doesn't always equate to the outcome that you want. And I learned this a lot when I was applying for grad school. So I would say just remember that, that your efforts don't always equate to the outcome that you want, and that's okay. Rejection is okay. Just be proud of the work that you put out there, the application you submit, etc., regardless of what the outcome is, and just know that you can learn from that and still improve as a researcher.
I just want to add, what are the risks you're willing to take, and what are the boundaries that are necessary?
Yeah, just building off of what Vanessa and Parlene were saying, I think always might sound obvious, but always stay curious and always be open to learning. Like, I've been out of UNBC, I graduated in 2016, but there's always new ways to do things, new learning, whether that's continuing education and doing, say, a Coursera data science certification, so that you're better able to work with the research you're doing, whether it's taking different research courses online, seeing if there's somebody that you could be mentored under. It just always stay open to the options and the possibilities. And then if you're at UNBC looking for research opportunities, really take the time to just look at not just your specific department, but all departments and what research might be interesting to you. I ended up having a thesis committee member from the anthropology department because it lined up with what I did. So keep in mind the interdisciplinary approach you can take and really look both within health, but also beyond. I think there's so much great collaboration and learning happening at UNBC that's so useful beyond when you're done.
I would say one thing to think about is when you're learning a new area of expertise, think about the skills that are transferable beyond that one niche. Whether it's presenting, whether it's writing, whether it's reading and concisely digesting information. Maybe it's data analysis. Sometimes data analysis seems like it's very, very narrow in your subject, but it's actually amazing how those skills can actually transfer to other aspects, and then that you're not narrowing your options, you're actually keeping your options broad as you move forward in your career, so you can make these sort of transitions into different paths.
In addition to what my esteemed colleagues have already said so well, I would also challenge you, if this is not your comfort zone, as so many of our researcher colleagues and myself have struggled with. Networking is a skill like any other. And for me, it was very uncomfortable at the beginning. So challenge yourself to go to those networking events. Challenge yourself to sit beside someone you've never sat before and to say hello and to find out what they do and to share what you do and to share those contact informations, because this research world is all about relationships.
Well, thank you all. I'm gonna just give it out to the audience or online. Does anybody have any questions for a panelist or all of the panelists?
Hi, my name is Saurabh, and I have a question for Jana. So, if you mentioned about your job being a data analyst, if it was a data reporting, database administration and all, I am doing graduate master's in computer science, and I have really good expertise in data and backend stuff, but I have no experience in health research. So, what are the important skills or things that you would recommend me to learn so that I can pursue a career in health research?
I think that's such a good question. And one of the other analysts that I work with at Carrier Secani, his background is in computer science. And so I think that healthcare and your field of study go together so beautifully. Might not be super helpful, but just try to get any exposure you can, whether that's within UNBC or other courses. For instance, LinkedIn Learning has courses on analytics in healthcare. And just, I think that's a great first step. It'll get you familiar with medical terms, terminology, might introduce you to certain programs and ways that analyses are done. Because if you're computer science, you probably have all the knowledge of some of the more advanced analytics, your like SQL coding, you probably have that skill set down. So then it's just, how can you expose yourself to some of the databases and language? And so maybe there's somebody in your program or in health that could connect you to a researcher in the health stream. So then you could start to get familiar with healthcare databases, which there's a lot, but more so just the language, all the language that's used, what kinds of projects, going on Google Scholar and finding examples of what sort of analyses are done and studies are done within healthcare. that can be done independently. And I think that's a great step. But quite honestly, like the other analyst on our team, he's fantastic. He didn't come from a health background, and it's more so just having those foundational skills, which you're working on, and then showing an eagerness to learn and expand on them. Not sure if that helps or not.
Any other questions from the room?
It's not a question, it's just a comment to us. I hear a lot from people just in general that research at UNBC might be limited by the resources available, but hearing the talks that I did, it seems like that's not really the problem. There is a lot of opportunity to expand, and there's a lot of resources to do that. Do you think that's true? Well, this one shouldn't. Anyone can answer that. Because that's big.
I'll maybe pose it, the question, I guess, is, do you feel that there would be limited resources here at UNBC in terms of your career, or would that be a barrier, I guess?
Not really in terms of career, in terms
Of training?
Training and, well, I guess expanding what is already at UNBC or
Or
barriers to that.
or growing research in Northern BC in general? Having a clinical trials team?
Yeah.
Well, on the clinical trial side, we're just getting started. Just watch us. Yeah. Stay posted.
And I think even if larger universities and institutions, sure, there might be a greater number of faculty and projects, but here there's also a smaller number of students. So your chance to get to work on those projects is actually greater. And I think the work being done here is always growing, always expanding. Just since I started at the university, there's more research opportunities. And so I don't think that's true from my experience. I think there's plenty of opportunities. It's just having the connections and knowing where to go to and where to look.
Also, we don't have that big city feel. You can walk into the hospital, knock on my door, and say, hey, I'm interested in clinical research. And I have some time this summer, and we can talk to my boss and figure stuff out.
It's interesting.
Like that handshake works.
Pardon me, I guess responses would be more from the student side, how to find opportunities as opposed to being someone else. But I think I was more asking from your perspective, already established in career. I'm not sure if that's already been answered, but from what I heard, I thought perhaps it hadn't been answered enough. But I've only come there. I came in a little bit.
Yeah, it's just a contribution to Jenna's response to the gentleman's question. If you are a computer scientist and you want to look into health data, you can start with MP4. MP4 is a data analysis software that is used for public health data. And it is free and you can download it. And there's so much data there that you can play around. And so it comes with the technology and everything. So that's a great place to start. Thanks, Janet. Welcome.
Janet works on the same team that I'm on at CSFS. So she is fabulous. And yeah, that was a really good suggestion.
So I guess, I think research resources are stretched everywhere, but you know, I think we've heard a lot of stories about here at UNBC and in smaller communities, how we're really kind of can think about how to use these resources in unique and creative ways to figure out solutions that work. And I just want to thank all of the panelists. Also, I hope you appreciate in hearing their stories that, you know, a career trajectory in health research isn't linear, how we always, because it kind of grow up thinking you do your undergrad, your master's, your PhD, and then you go into academia. But there's all these different paths you can take, and just because you go in one direction doesn't mean you can't come back and go another direction. So whether people grew up here and have stayed here or gone away and come back or came, I think we just have a wonderful group of researchers here, and we're also, I guess I'm coming here, it makes me happy just to see this group and see all the wonderful people that we have working on projects to make, I guess, lives of people living in northern BC better and healthier. So thank you. And we do have the room for a little bit longer. So for the trainees that are here, if there's any treats left, feel free. If you would like to come up to talk to the panelists in the room, sorry, online, I don't know if we can do that, but feel free to sit around and mingle and chat for a little while.
Thank you for having me. If anybody has any specific questions for me, the organizers have my email, so please share that with any students and so that they can email me, and I'm happy to answer any questions.